Good morning. My name is Bisi Ademuyiwa. I'm a medical oncologist and I take care of women who have been diagnosed with breast cancer. I work in a large academic institution in the Midwest, and this is the third video in my series that discusses breast cancer, and I'm really trying to use this forum to educate the lay public. Again, none of these videos is designed to replace the patient-physician relationship. And so if you have a suspicion for breast cancer, you have a breast abnormality or a lump, please kindly seek a physician's opinion and treatment. So for this particular video, I thought I would talk about breast cancer screening and what to do if you do not have a diagnosis of breast cancer. And so to start with, I think the first, the most important thing is, or one of the most important things rather, is for every woman to really understand her family history. So certain individuals are more predisposed to developing cancers than others. And family history, understanding your family history can help you figure out if you are at a higher risk than the general public, members of the general public. And so for every woman, you should really try to understand your family history, particularly first-degree relatives, so parents, siblings, or children, as well as second-degree relatives. These are grandparents, aunts, uncles, cousins, nephews, nieces, and such. So for instance, if there are multiple members in your family who have had breast cancers or ovarian cancers, particularly breast cancers occurring at a young age, or if there's male breast cancer in the family, and if these cancers cluster on a certain side of the family, maybe the maternal side or paternal side, then you might want to talk to your physician about what your specific risks are. Also, if there are certain cancers running in the family, such as breast, ovarian, pancreatic cancers, colon cancers, again, you might want to talk to your physician about what your specific risks are. But in the absence of any strong family history, the best way to screen for breast cancer for the average individual is really screening mammograms. And what is a screening mammogram? A mammogram really is just a special x-ray of the breast that detects breast abnormalities. And so abnormalities can appear on the x-ray as specks of calcium, which are called calcifications, and these may indicate cancers. There are also lumps, tumors, or masses that can be seen on the x-ray that may give a concern for breast cancer. And again, just to be very clear, a screening mammogram does not prevent breast cancer. It only detects it as an early stage when it is most curable than the advanced stages. And also, screening mammograms do not cause breast cancer. The amount of radiation in a screening mammogram is exceedingly small. And so this particular procedure is, a woman would undress from the waist up and then would be asked to stand up or sit down if necessary, and would place her breast. The technician would help her place her breast between two flat plates that sort of compress the breast down and stretch it out so that very good pictures can be taken. The test itself is not painful, might be a little bit uncomfortable, but certainly there's no pain, and really is a very quick procedure. It really doesn't last for anything more than 10 to 15 minutes. It is very important that after your mammogram you get the results of the test so that you can know whether the test is normal. Then the next mammogram would be either in a year or two, depending on your age, or if it's abnormal, then what is the next step? The radiologist or your doctor may suggest a mammogram in 6 months if they don't think the abnormality is all that concerning, or they may suggest a biopsy. And a biopsy really would give a diagnosis about what that abnormality is. And a biopsy pretty much is sticking a very small needle in the area of abnormality so that some of the abnormal tissue can be taken out with a needle and sent to a pathologist who then looks at it under the microscope and gives a final diagnosis. Now, who should get a screening mammogram? The American Cancer Society recommends that all women between the ages of 45 and 54 gets a screening mammogram once a year. For women between the ages of 40 and 44, starting mammograms once a year is also an option, and I still encourage my patients to start screening mammograms at the age of 40 because there is breast cancer that develops at that age as well. And then for women over the age of 55, the American Cancer Society recommends that a woman can go to screening every other year, or the option of remaining on a yearly schedule is still available should they so desire. And then mammograms should be continued as long as a woman has at least 10 years left to live. Again, the mammograms do not prevent or cause breast cancer. They just aid us in diagnosing breast cancer at a very early stage when it is most curable. The other thing that an individual can do is breast self-awareness. So recently, up until about 2 or 3 years ago, there was a recommendation for clinical breast examination for all women, which is a breast examination that is done by a medical practitioner or physician, and breast self-examination. But recently, the American Cancer Society has concluded that research has shown that these examinations do not help women live longer if they are diagnosed with breast cancer. However, the recommendation still exists that every woman should practice breast self-awareness, which really is just knowing what your breasts feel like so that if there is an abnormality, you can bring that to medical attention. And so how do you practice breast self-awareness? What I recommend is that a woman do this on a regular schedule. I usually recommend once a month, so either the first day of the cycle or the first day of every month. You can choose which is convenient for you, and sort of just feel around your breasts, the left and the right. Feel around every area of the breast mound, below the breast mound, and also in the armpit. Look at the skin of the breast, look at the nipple areolar complex, so that you have a good understanding of what your breasts feel like, so that if there is a deviation, if there is a change in what the normal is for you, you can certainly bring that to medical attention. And so these are just some of the ways to help yourself in the fight against breast cancer. First of all, know what your family history is, particularly if there are multiple people, particularly with early onset breast or ovarian cancer. And then if you have this situation, bring that to medical attention, so perhaps you can start screening earlier than the usual population. All women in general over the age of 40 should be getting a mammogram once a year to detect breast cancer when it is the earliest and most curable. And then every woman should practice breast self-awareness so that you know what your breasts feel like, and if there is a change, you can certainly bring that to medical attention. And again, just to wrap up, breast cancer is extremely curable, particularly when it is diagnosed in the earlier stages. And most women who are diagnosed today with breast cancer are able to live full, productive lives with proper treatment. Again, this is Bisi Ademuyiwa talking about breast cancer. Thank you so much for your attention, and thank you for listening.